Several states are reporting an alarming rise in COVID cases less than 2 weeks before Thanksgiving. In Colorado, COVID wards are nearing capacity. 80% of those patients are unvaccinated. Mola Lenghi is there.
Colorado's surge in average daily COVID cases, up 17% in the last 2 weeks, is pushing the healthcare system to the brink.
Certainly at the rates that we're going, we're not slowing down right now.
95% of Colorado's ICU beds are in use, more than at any other point during the pandemic.
As we're moving into the winter season here, is there a certain sense of anxiety as we're approaching?
Yeah, absolutely. I think everybody just worries, where are we at? What are we going to do?
That anxiety prompted Governor Jared Polis to issue an executive order allowing all adult residents to get boosters. California and New Mexico have done the same.
Please, if you got the vaccine 6 months or more ago, get your booster. It's a really important part of protecting yourself. It's a really important part of ending the pandemic in Colorado.
This is at odds with federal guidance that limits the extra shot of either Pfizer or Moderna to vulnerable adults and those at high risk for exposure. As cases climb again, health officials continue to encourage pediatric vaccinations.
Get your 12 to 17-year-olds vaccinated and get your 5 to 11-year-olds vaccinated.
The CDC now advising parents, if their child is about to turn 12, not to wait to get the adult dose.
Boys, high five.
And for those who turn 12 in between vaccinations, to get the adult dose for the second shot. At least 14 states have had a rise in hospitalizations in the last week compared to the week before. Michigan is at a 6-month high. Beaumont Hospital in Detroit reports as many as 35% of its current patients are fully vaccinated. Back in Colorado, resources are stretched thin, and so is the staff.
I don't know how anyone could not have feelings of burnout based on what we've endured these last 2 years.
Health officials here in Colorado predict the most hospitalizations ever during this pandemic between now and the end of the year. With ICU beds already nearing full capacity, the governor is calling on hospitals to try to find up to an additional 500 beds, putting even more pressure on healthcare providers. Some already at a breaking point, Lana.
As we are well aware, Mola, thank you. For more, let's bring in Dr. Bio Curry-Winchell. She is a regional medical director and family physician at Carbon Health in Reno, Nevada. Dr. BCW, thank you so much for being here. So with COVID cases rising in so many states, what should Americans be thinking about as we enter the holiday season, but also the cold and flu season?
Well, first, thank you for having me. We really have to be mindful as we enter the holiday season, and we know we're going to be having more family gatherings as well as indoor activities, that we really wear masks, especially if we are unsure of the vaccination status of those who are attending the event. So it's important to, really remind ourselves of the measures that really help mitigate the virus so we can enjoy our family gatherings and do all the things we love to do during the holidays.
Well, the children's vaccine has been underway for about 10 days now for that group between 5 and 11. You're a family physician. What are some of the common questions that you're getting from parents about vaccinating their children?
The most common question I get, because I'm a doctor and a mom of 2 young girls, 5 and 7, are you going to vaccinate your children? And should I really move forward with getting my child vaccinated? And my answer is absolutely yes. This is a way to protect our most vulnerable population, our children. And we know if they were to contract COVID-19, there can be long risk complications that can occur. So that is the number one question I get. And I really encourage parents to reach out to their family doctor, their pediatrician, and really talk about your child's risk and health history.
In September, President Biden announced a vaccine mandate for healthcare workers, saying it's intended to protect vaccinated workers from unvaccinated coworkers. Now a group of 10 states is suing the Biden administration, fearing that the requirement could lead to worker shortages. But the mandate is a requirement that also protects patients as well. So with that in mind, should patients ask their healthcare providers if they're vaccinated? Is that a question that should now be something that we talk to people about when we're interacting with them in a healthcare setting?
Well, as a healthcare provider, our goal is to provide the best care possible to our patients. And that means making sure that we don't pass anything along to our patients. And so I think it's important that healthcare systems and organizations think about how are they best protecting their patients. And whether it's through providers or support staff, you need to make sure that you can adequately provide the best care possible. So to your answer, I would definitely say have each patient reach out to those healthcare systems and find out what is their policy so you can make the best decision for yourself and your family.
I like the permission to feel empowered. All right. Dr. BCW, I want to ask you about the long-term prognosis for COVID, because many experts, including the U.S. Surgeon General, believe that the coronavirus will likely be with us for a while. And some say we may need to get vaccinated every year. Given the incredible speed at which 3 approved vaccines became available here in the United States, why is eradicating this virus so challenging?
Well, just naturally, viruses mutate, and unfortunately, we haven't reached the level of herd immunity. And so, as the virus continues to mutate, it is able to really, transmit and unfortunately get people sick. And so, as we move forward, we have to remind ourselves, how did we eradicate diseases in the past? And that was through vaccinations as well as boosters. And so, as time goes on, yes, we will probably need a booster, but it provides a level of protection to, control the virus. Will we be able to eradicate it? Probably not. But our best chance at controlling the virus is through vaccinations.
All right. Dr. Bio Curry-Winchell, thank you so much. And thank you for all that you do.
Thank you for having me.